we're talking about something that is maybe just a few decades old, where foreign assistance or some kind of recognition that is sought after by that nation is tied to pressure and threats associated with them changing their laws, changing their policies, and adopting a progressive agenda, whether it be abortion or other things, in exchange for that.
Welcome to Caring for Both, a curbside consult series by the American Association of Pro-Life Obstetricians and Gynecologists, or APLOG. On this podcast, we bring on experts to provide insights to support you as a medical professional in your life-affirming practice and career. I'm your host for today, Dr. Christina Francis, board-certified OBGYN and also CEO at APLOG. One of the most encouraging actions, I think, of this new presidential administration was to rejoin the Geneva Consensus Declaration, a coalition of now 40 countries committed to advancing women's health, strengthening families, pushing back against the narrative that induced abortion is an international human right, and affirming the right of nations to govern themselves, free from ideological colonialism. The declaration was first written in 2020 with the U.S. as one of its founding members, but unfortunately, our membership was revoked by the Biden administration until last month. Here to discuss the Geneva Consensus Declaration, why it exists, and its implications for global health policy is my friend Valerie Huber, who spearheaded the creation of the declaration during the first Trump administration, where she served as the U.S. Department of Health and Human Services where she served at the U.S. Department of Health and Human Services as U.S. Representative for Global Women's Health. Today, she serves as the founder and president of the Institute for Women's Health. Oops, sorry. I'm going to start that part over. Too busy reading the script. Okay, we'll start. Today, she serves as founder and president of the Institute for Women's Health, where she promotes women's global health priorities, empowering women to thrive and achieve optimal health at every stage of their lives. Valerie, thank you so much for being here. It really is an honor to have you on.
Oh, Christina, I so appreciate the work of APLOG, so it's great to be a part of today's podcast.
Absolutely. Well, Valerie, can you just tell us a little bit more about yourself, specifically how you became interested in international work and specifically as that pertains to the issue of life?
Yeah. Well, when I was in Trump administration, Trump 45, the first 2 years I worked on domestic policy, and I really saw the intersection between women's health and how, unfortunately, um, political agendas could easily take precedence over that when advocates were more interested in pushing their own priorities rather than actually putting a focus on helping women improve health, both here in the US and then when I moved to the international space internationally. I think it became especially um, notable when the position as U.S. Special Representative for Global Women's Health was was created actually for me, and there were a couple of things that were immediately apparent. Number one, that we who really care about women, their health, their thriving, uh, even before they're born, and through every stage of life, versus those who use women and women's health for their own agendas. And it became especially apparent at the United Nations when member states were coming together supposedly to promote women's health in certain UN resolutions. But I saw that there was really a dichotomy between what we were there to accomplish and what the underlying agenda was. And I have to say that um, I love policy. I don't mind having a conversation with anyone, whether we agree or disagree, as long as it can be a reasoned conversation. But this is more than policy. This is more than a conversation. These are the lives of real women and girls, both here in the US, but especially when I was working internationally, to women and girls who are in some of the most vulnerable situations that we can imagine, where they don't even have access to um, a, a modern clinic with skilled practitioners there, and we're debating about abortion.
Right.
It's crazy.
Yeah. Yeah,
So
absolutely.
so yeah, so that job turned into a passion, I have to
Mhm.
tell you, within a matter of hours. And it has not ceased since then.
Oh, that's so amazing. I love hearing your heart too for women, especially in many of these places, as you said, that don't have access to even the most basic of care. I spent 3 years working at a mission hospital in rural Kenya and saw that firsthand, saw the things that women need in order to improve maternal mortality rates and just improve their overall health. And I think it is a true disservice, not only to women in other countries, but women in this country to equate women's health, to say that the only thing that's important about women's health is their ability to terminate their pregnancy. And I think, from what you're saying, we see that at the UN level. We see that certainly in this country where that seems to be the sole focus for so many people. And so you saw the importance of, not only do we should we not focus on this because induced abortion is something that many women, and especially in these other countries, don't even want. They don't want this brought into their country, but also their health issues are so much bigger than this, and there's so many more things that they need. So can you tell us then a little bit more about the story of the Geneva Consensus Declaration and why the first Trump administration authorized you to lay the groundwork for this really historic coalition?
Yeah, I think that responsibility that I was honored to have to create the Geneva Consensus Declaration as a result of what we had learned um, was probably a turning point, not only in U.S. policy, but countries coming together for the first time around shared values. And the commitments made within the Geneva Consensus Declaration, as you kind of summarized at the top of today's broadcast, was it doesn't matter where a country is currently in terms of health and thriving for women and girls. It's the commitment to be on an upward trajectory. And that means we can applaud every single incremental improvement. This is not looking at a slate of countries and looking at the ranking. It's
Mhm.
looking at every country and applauding positive gains. But it's also, and you also mentioned this, that countries are coming together saying there's no international right to abortion. It is not a human right.
Mhm.
It's up to the countries to decide how to legislate on this. But no way should another country, a
Mhm.
foundation, an international organization like the UN or World Health Organization should not be pressuring countries to walk away from their defense of life in their country. So that's a second, and the third is really the essential unit of society. Really is the family, and we know that if we're going to have healthy women and girls, we also have to have healthy families. And this is looking at not just thriving right now, but it's looking at civilizational
Yeah.
health and continuity. When I started talking to other countries in the role as special representative, I heard a narrative over and over. And I have to tell you, initially, I didn't even believe
Mhm.
that it could possibly be true. And that was that the United States had been pressuring countries to liberalize their abortion laws, uh, um, not not in a real public manner,
Mm-hmm.
because it's actually against the law for the U.S. government to do that, but in subtle and sometimes not so subtle ways, but maybe not keeping a paper trail.
Mm.
Honestly, Christina, I thought, this doesn't sound like America. I can't believe this is happening. But when I heard this over and over and over again, I knew that it was true. And hearing that and other ways that ideological colonialism had crept into not only our foreign policy, but in the foreign policy of other nations that provide foreign assistance to countries around the world, I thought, countries that are pushing these progressive agendas are very well organized. So why isn't there a coalition
Mm.
for those of us who have another view and but have every much a priority on improving health and thriving for women and girls?
Yeah.
So that really was the inspiration for the start of the Geneva Consensus Declaration, because there are courageous leaders in countries
Mm.
who have stood for a long time for these values around life and family, but they've stood alone.
Mm.
And so then they become an instant target, and it's much easier to pick off one country after another country after another country. But when countries are joined together in solidarity, that
Absolutely.
is a strength much stronger than the sum of its parts.
Yeah, absolutely. Absolutely. Well, you bring up the term we both have, ideological colonialism, and maybe there might be people listening who maybe this is the first time they're hearing that phrase. I first heard it from an amazing speaker from Nigeria who I'm sure that you have interacted with, Obianuju Ikiocha, who really stands up for life and says, in her tribal language, there was not even a word for abortion because it was just so unthinkable to them culturally to do that. Can you just give a brief, like, what do we mean when we say ideological colonialism? Because, of course, I think many people in the US would say colonialism is a bad thing, a part of the past that maybe most people don't agree with, but maybe don't realize that there's a different form of colonialism that is occurring now.
Well, I'm really glad, first of all, that you introduced the term and at the beginning of today's podcast. We use that regularly, and I will tell you that most foreign assistance is um, provided to developing countries, and many of those developing countries have been colonized in the past. But we're not talking about that colonization. We're talking about something that is maybe just a few decades old, where foreign assistance or some kind of recognition that is sought after by that nation is tied to pressure and threats associated with them changing their laws, changing their policies, and adopting a progressive agenda, whether it be abortion or other things, in exchange for that. And this pressure can be extremely strong, especially when there is a kind of a coalition of that pressure coming together. So what we see often take place is you might have several countries that provide foreign assistance to the same country.
Mm.
You might see also foundations that work with these countries, but these foundations also provide foreign assistance to the same countries. And you may see NGOs which are funded and even stood up in these countries with the funding of both the external countries that provide foreign assistance or the foundations. And the purpose of those NGOs are actually to uproot the traditional values and the culture of that country. So those NGOs aren't being placed in that country to respect the sovereignty of the nation, to
Mm.
respect the underlying religious and cultural values of the country,
Mm.
to even identify the most critical needs in that country. They are there for an agenda, and And it is an agenda that is more times than not diametrically opposed to the values both of the leadership of that country and its people. So when I use the term ideological colonialism, when I'm visiting a developing country, I don't need a definition.
Mm,
They know exactly what we're talking about, and they see it as disrespectful.
mhm,
They see it as offensive, and they see that even though this is their country, it is being taken from them.
mm. Wow. How condescending and paternalistic, is that of countries in the West, including our own, unfortunately, in the past. Um, to think that we have the right to go into another country and dictate what their policies should be, especially on things like this. And that's one of the things that I loved so much when I first heard about the declaration, and the purpose of it was that it, and correct me if I'm wrong on this, but sort of its guiding principle was national sovereignty, that the people running the country know best what their country needs, and where their country stands, and as you said, countries from maybe who have varying policies on abortion or other family related issues still being able to come together to say, we want to be able to determine the fate of our own country, what we do in our country, and standing against this sort of imposition of an international quote unquote right to abortion and other things.
Yeah.
Um, Besides the U.S., I know of at least one other, but who else were sort of the founding drivers of this declaration? What other countries joined with you on that?
Yeah. So when we actually had the idea to create this within the Trump administration, we realized that if this is going to be a coalition of nations, it shouldn't be just one nation
Yeah.
that's founding this. It needed to be a coalition from the very start to negotiate the declaration amongst that core group, and then to fan outward to the world, to bring in other like-minded countries. So initially it was Brazil, Egypt, Hungary, Indonesia, Uganda, and the United States, 6 countries representing every major region of the world. Um, and we hammered out our differences, which actually were very minor.
Mm,
The original draft changed very little, which showed that this was really something that
mm,
um, was sympathetic with the heartbeat of nations all around the world. And then from there, um, we began talking to other countries about joining in. And that brings it to today, where we have about 40 countries, again, representing every region of the world in the Geneva Consensus Declaration. The US was originally the secretariat for that.
yeah. Hmm.
Um, and right now it is the country of Hungary that is the secretariat.
It's amazing. So amazing. And what impact have have you been able to see of the declaration, perhaps on US or global policy? What good have you seen start to come out of this?
Yeah. Well, the unfortunate thing about the coalition was that it was signed just before President Trump left the first administration. And then immediately thereafter, President Biden removed the United States from that coalition. I'm quite certain that it would have floundered and probably died had it not been for the government of Brazil immediately taking up the secretariat then. And we at the Institute for Women's Health worked very closely with Brazil to not only continue that coalition, but build upon it. Uh, and that is very monumental, I believe, because there were news articles written that the Biden administration was certain that the GCD would die as a result of the US leaving.
Mm,
And I'm happy to say that it not only did not die, but it continued to grow. And from that date, when it was first signed in 2020 until now, there has been a knitting together of that coalition. The U.S. Congress and our institute and some other GCD countries. It's always been Hungary as the secretariat have has co-sponsored an annual commemoration
mm,
where last year 40 countries came together. And what I saw and see in that room is very encouraging because countries that ordinarily would have no reason to get to know one another that well
mhm,
are becoming friends, are talking about common ways to expand the impact of the GCD, not only in a defensive manner against external influence on these issues, but
mhm,
in ways that improved a lot of their people in their country, which
mhm,
after all, that was the whole goal of the GCD in the first place. It wouldn't have even come to be had it not been for that ideological colonialism that we saw taking place
mhm,
and that countries were bearing the burden of that, where they had to focus on thwarting the ideology when
right.
their efforts could have been better spent improving health and thriving for their women, girls, and families.
Yeah, absolutely. It's so exciting to hear that too of, countries sharing with one another their successes. I know I had the privilege of being at that commemoration in 2024 and got to hear a presentation from Hungary of what they have been doing to strengthen families, encourage family formation in their country. And I would imagine that there's a lot of information sharing and learning from one another. As you said, from between countries that maybe historically would not have been interacting like this. They're coming from every faith background or no faith background, and yeah, in all parts of the world. And so I think it's just an amazing thing that you have helped facilitate to bring these countries together, not in a way that is telling them what to do, but allowing them to flourish in the way that is best for their own country. And certainly we're all, I think, in a better place when we can be doing that in our own country, but also learning from others of what's working for them, what's not working for them, and things like that. So,
Yeah, and Christina, something else that's come out of that is as we met and talked to countries, we realized that there were common vulnerabilities, not
mhm,
only to the common defense of these values, but also some common needs. And so we created, as a result of conversations with the countries, a model called Protego that is really designed to help the countries operationalize those commitments that they made in the GCD. And
mhm,
I really think that that is showing that this can be a real game changer because as countries receive research and we partner with them to meet some of those needs in terms of policy and then programs.
mhm,
This can change, as one country said, the trajectory of their country for generations. And they got so excited. They thought it was just another program coming to their country. And when they realized that it could be a game changer for their nation, they and we became excited. So a lot of great things have come as a result of just that initial coming together, signing a declaration.
yeah, so amazing. So amazing. What a testament to what can happen when we don't just tell people what's best for them. I think there's so many parallels just to the abortion issue in general in my mind with this, but we don't just tell people what's best for them and impose something on them, but we give them the tools that they really need to truly empower them and allow them to make changes, whether it be, on a national policy level or just even in their own lives.
Yeah.
Um, As we wrap up here, I'd love to hear about, the work. Obviously, the Institute for Women's Health did amazing work in the 4 years of the Biden administration, helping keep a U.S. presence as part of the Geneva Consensus Declaration. But tell me about some of the things that you all are working on. Is it just the declaration, or are you working on other things as well?
Yeah, well, I just mentioned Protego. So that model is taken from a Latin word, which means to defend and protect.
Mm,
So Protego is designed to come alongside a nation to protect and defend its people, its nation, and its future. And really, those are all inextricably linked.
mhm,
And so, one of the policy models that we created was a women's optimal health framework, and we partnered with the First Lady of Uganda last year to introduce it to the world, and she caught the vision to introduce it to their neighbors throughout Africa.
amazing.
We partnered with Guatemala on the education piece to Protego, and they wanted, together with their Ministry of Education, uh, to create a parent-child communication guide that
Mm,
would empower parents from the very youngest ages to build that family togetherness and that trust relationship between parent and child, to talk about some of the most sensitive topics, but
mm,
in a way that is consistent with the family values, but also in a way that that not only empowers parents to have these conversations, but in a no drama kind of way.
sure.
Um, and I never expected a minister of education, which is like would be like our Secretary of Education, to say, no, I don't want another curriculum implemented in our schools. I want something that will help our parents
Mm,
and the children who are coming to our schools to be educated on important things as a foundation for what they will learn in school, and that is consistent with what we want to teach in our schools. But it's the parents who need the empowerment more than the teachers here in our schools. So it's really been beautiful. And as many countries as we've had these conversations with, there hasn't been a single country who hasn't said, we want Protego in our country. The
mm,
most recent one, and I'll just briefly share this, is with Burundi. I was
mm,
there in early early this year, and um, the president told me that he wants Protego to be the policy of the nation of Burundi, which is just amazing. And what I really like about Protego, of course, I'm going to be a little biased here, but it's so consistent with what brought countries together with the GCD. It's not us coming into a country and saying, here are some resources. We can have those translated in your country, and this will meet the needs that you have. That
mhm,
isn't how we work.
mhm.
We listen, we value. Who knows a country better than the country itself? And then they have to commit to be all in, and we commit to being all in. And
Mm,
ultimately, the ownership belongs to the country. And so when a president says, we want this to be our national policy,
yeah.
that communicates that message very clearly. And the president of Uganda is very supportive. The president of Guatemala was very supportive of Protego. So this is a model that we're seeing. The faith leaders are supportive. The
Mm,
influencers in the country are supportive. We don't leave any stone unturned, because we know if there is going to be a long-term change and improvement,
mhm,
that it means everybody has to roll up their sleeves, and we'll be there as long as we need to be, but ultimately it belongs to the nation, and
mhm.
they can with pride look at the upward trajectory
Yeah.
as a result of that.
Yeah, how amazing. This is so exciting to hear, and I think so wise, again, having spent a small amount of time overseas, and seeing how working between countries can be done well and be done not well. It's just really exciting to hear the work that you all are doing of, as you said, respecting and listening to the individual nations and understanding that they will know how best to do this, not us coming in from the outside. And I just love the support and the empowerment that the Institute for Women's Health is giving. I'm sure that there are so many other things that we could talk about with the Institute. So if people want to find out more, where can they go to learn more about the Institute and the work that you all are doing?
Well, we would invite them, first of all, to visit our website at theiwh.org. And then once they get to our site, follow us on X. And as things are new, our website doesn't tell it all, but our tweets on X do.
Okay, awesome. Awesome. And we'll make sure to link to the website in the show notes today. So, Valerie, thank you so much for coming on and joining our podcast. I know that it was very, very informative for all of our listeners and watchers, and we will look forward to keeping them updated on the work of the Declaration as well as your Institute.
Great. Thank you, Christina. It was such a delight to be here with you.
Hi there, this is Miriam Diallo, Applog's Communications Manager, and before we close out today's episode, I wanted to quickly show you an exciting new video that our team at Applog recently produced. It explains Applog's history and purpose within the pro-life movement and encourages all pro-life medical professionals and allies to mobilize behind pro-life physicians as they forge a new path forward in medicine. Here it is. Hope you enjoy.
There's never been a time in Applog's 51 years of existence that it was more important that we exist than right now. We can be effective within the pro-life movement in a way that no other organization can be. We were established as a special interest group within the American College of OBGYNs. That special interest group actually then quickly became the largest and remained that way until 2013 when ACOG dissolved the title of special interest group.
And so even though we've been around for 50 plus years, we formally became a second organization to be a different voice that no longer could speak within ACOG.
What we have seen over the last approximately 20 years is that ACOG, the American College of OBGYNs, are throwing aside sound medicine, evidence-based medicine, in favor of this ideological agenda of abortion with no restrictions, no barriers, no limits whatsoever. And I see that being harmful not only to our patients, but to our profession.
I don't think a lot of practicing physicians are aware of just how bold ACOG has been regarding the blatant lies that they're telling related to induced abortion.
Our voices are so important right now because of the lies that are coming out of the medical field that are scaring people into supporting abortion when they otherwise wouldn't. That has spurred us on at Applog to speak truth to fellow medical professionals and to speak truth to the culture that induced abortion is not healthcare. It ends the life of one of our patients, and it oftentimes causes significant harm for our other patient.
If we didn't have Applog's voice, there would be one narrative, and that narrative would be that the direct and intentional killing of one of our patients is normalized in medicine.
With Applog leading the charge, doctors can make a difference in this fight for life. We are speaking up louder and more boldly for the truth and for the lives of both of our patients. We're doing that by providing alternatives for medical students to go to life-affirming residency programs. We're doing that by actively seeking out ways to get the truth out there in medical journals, in the media, and in the court of public opinion, instead of people just being fed the false narrative that the pro-abortion lobby would like for them to hear. And we're seeing that makes a difference. We're seeing wins in states now where doctors are speaking up. Our membership is growing. We are serving as an example to groups all over the world.
The one thing that gets me most excited about the future of APLOG are the actual doctors themselves who are waking up and starting a revolution and saying, no more, you do not get our profession. We need every single one of those voices out there, and APLOG is leading the way. APLOG is connecting individuals to the needed resources to be the voice for their practices, their hospital systems, their local communities, their states, and this nation.
We have plans in place to reach physicians and medical students in every state in this country to get them into their state houses, talking to their lawmakers, testifying about the impact of abortion on their patients, and continuing to spread the word to women out there who are facing unplanned or complicated pregnancies that we are there for both you and your child.
APLOG is an organization that gives its members courage. This isn't an easy battle. It's every day. Sometimes it feels like it's every minute. To know that there's an organization that is in the arena, in the battle, gives me great confidence to keep fighting.
We are the ones who represent true medical advancement, true medical science, and the way that medicine was meant to be practiced. We need people to join with us to help us mobilize and equip our physicians to go out and be a voice for life and a voice for change.